have the light say live.
Mm-hmm. Hello, everybody. Thank you for joining us here today. My name is Fabiana Baquin. I'm the Executive Director of the Canadian Premature Babies Foundation. Since the beginning of the pandemic, I'm hosting Facebook Live every Monday and Friday, 1 p.m. Eastern Time, and I'm bringing healthcare professionals, researchers, and parents from all over Canada to talk to us about what is happening in the hospitals across the country, but also to address parents' questions and concerns. We have all the sessions recorded and they are available on our website on canadianpremis.org. And yesterday we launched the Zero Separation Campaign, which is an initiative from GLANCE, which is the Global Alliance for the Newborn Care. The campaign is all about keeping parents together during the pandemic in hospitals all over the world. The campaign has been endorsed by over 150 organizations from all over the world, including the World Health Organization and UNICEF. And right here in Canada, we have our own advocacy group. Doctors from New Brunswick are coming together to really advocate for parental presence in the NICU. And to talk about this today, I have here Dr. Luis Monterrosa, who is a neonatologist and assistant professor in pediatrics, neonatal division of Dalhousie University, work at St. John Regional Hospital in New Brunswick. He has been involved in family integrated care, non-invasive ventilation in preterm, antibiotic stewardships in the NICU, exclusive human milk diet project, donor breast milk, EPIQ, and the Canadian Neonatal Network projects. Dr. Monterrosa, thank you so much for joining us here today.
Hi, Fabiana. Thank you very much for your invitation. I would like to congratulate you and all your team at the Canadian Premature Baby Foundation for the phenomenal work that you are doing on behalf of the families and babies with neonatal care needs in Canada. Also, what a way for two immigrants, yourself from Brazil, myself from Colombia, to give back to this wonderful country, Canada, for opening this door for us some time ago. So thank you very much.
Absolutely. Thank you so much. Your passion for the work that you do is absolutely inspiring to us at the foundation. And every time we have an opportunity to collaborate with you, you're all over it. Because I visited your unit a couple of years ago and I was truly impressed with your work. And now you and eight neonatologists from 3 different hospitals in New Brunswick have come together to advocate for parental presence in the hospital. And you just submitted a letter to the Minister of Health last week. Can you tell us about this letter and what you wish to accomplish?
Thank you, Fabi. Hopefully you don't mind I call you Fabi, but this is a very common thing in Latin America. This pandemic took everybody by surprise. Canada has acted swiftly to address the healthcare concern of their citizens and had been protecting all the vulnerable population like the immunosuppressed and the elderly. Hospitals had been to adapt and change their policies in this ever-changing information about this new virus. One place of this policy had been hard hit have been the neonatal care unit. We do understand that this pandemic poses a real threat to ourselves, but also we should respond in appropriate to the situation. This is a challenge to guess or bring up the best of us, and to be succeeding in this endeavor, it implies enormous generosity, collaboration, and leaderships. This is the time to bring the best of us to improve the care of these babies. We need to reinvent ourselves. Every aspect of our life has to be reinvented, and we have to build a better future for those babies and those families. And no better time to do it like now. We should prevail. So what we found is that policy has been changed, and we as a healthcare team were abiding by those changes until we start noticing the harmful effect that those changes are bringing to those parents and to those babies. So our neonatal healthcare team in New Brunswick are compounded by 3 neonatal intensive care unit level 3, and all the neonatologists and the rest of the neonatal team, including neonatal nurses, respiratory therapists, nutritionists, and pharmacists, which is part of the team, start storming idea, and we thought that a joint approach will be the best action that we should do. And we wrote this letter to the Ministry of Health. So far, we haven't heard back anything yet.
So what do you wish to accomplish with that letter? Are you expected to have meetings and work in collaboration with them?
You know, what we're looking is partnerships. So we, as a neonatal care team, know very well how to prevent infection in our unit. We have been able to challenge our policy in a way that we know how to avoid spreading infection. So we do understand the health workers have worry about becoming infected or infecting those people around them. But at the same time, there is a lot of healthcare workers very worried to be put in a situation to enforce harmful policy to the babies under their care. So what we're looking here is listen, yes, we have to take action, but we have to match our reaction to the real situation. You have a group of experts here, let's work together and minimize the impact to these changes are making in these parents and the overall health and developmental outcome in the long term.
Absolutely. What is the situation in the NICUs right now in terms of parental presence in the NICUs? Because it's been so different from hospital to hospital, even in the same city. We know the disparities in care across Canada. Some hospitals never change the policy. Other hospitals have to put visiting hours, which this word, I can't even believe that came back into this collaboration between parents and the healthcare professionals. So parents are now seen again as visitors in many hospitals. So how is the situation in your province?
Well, you know, when you are reading all the information by the experts worldwide, you realize that all the progress that we have been reaching so far in maternal, prenatal and maternal and neonatal care have been pushing back to the dark age that we were fighting together to bring out. That means bring the parents to the daily care of the babies jointly with the neonatal care. And you have a beautiful, a variety of draconian measures to the middle ground measure that we have here in Canada. And I can comment about some hospital in Europe or in South America avoiding or prohibiting the total presence of the pregnant woman with a partner in the moment of delivery, or those parents who have been having premature babies in the unit, which is totally devastating for families. To the actual situation that we are confronting in North America and United States and Canada, where we are only allowing one parent at a time, and we are putting the pressure between both parents to choose which one is the one to be selected to be, which is unfair. We know mothers have to breastfeed those babies sometimes and have to express themselves to make that breast milk available. So it's a hardship put it on the father at the same time. So I can go on and on in different measures that have been taken around the world, but at the end, it's harmful for the parent, for the family, and for the babies. So we need to look for a middle ground. What happened here in New Brunswick was that we as a healthcare harness in the care that we provide with the administrator, were giving instruction for changes in policy that we had to abide for. And we start doing it until we start noticing some harmful effect coming from the parent, from the baby, and from the whole care team themselves. So we start asking ourselves, what's going on here? What are these measures evidence-based facts, or they are just worldwide policies to prevent in a shotgun effect the dissemination of this virus? So that was the first step. The second step was to propose something, and then we moved from has to be one and you cannot go outside of the hospital to yes, we're gonna allow one parent at the time. So that's what we have right now, one parent at the time, all the time. We were only limited by time at the beginning, now it's all the time, but one parent at the time. So I think we are making progress, but we are not there yet where we want to be.
Okay, so how are you suggesting parents to come back to the unit? Because in the beginning of the pandemic, there was a lot of fear-based decisions that were made in hospitals all over the world. And of course, it was the first response. Nobody knew exactly how the virus was affecting the preterm babies, but also in a lot of countries that there was not enough PPE for the healthcare professionals, how they would even allow or let parents come in. So there's a lot of those conversations, but now 4 months into the pandemic, we know things have been changing. We situation from province to province have also been changing. How are you suggesting parents to come together to the unit at this time? Because I understand, okay, we can have the mom only, and then perhaps the father or the other parents cannot come to the hospital at all, or don't even know the baby, because we've been getting those stories from parents, babies being hospital for 70 days and the father hasn't met the baby yet. So how can we, in a safe way for the team in the hospitals, and also not to create more harm for babies and families, to bring them together?
All come to the point to that word uncertainty. And that uncertainty that everybody has at the beginning, at some point we still have in different aspects, but that uncertainty, it produces fears. And fears is important, but you have to learn how to confront the fears and not overreacting. So we do understand what that came from. Initially, all the concern also was from the healthcare worker in the front line, talking about NICU only. And this is understandable that the nurses and all the neonatal team around the baby, including the physician, will be worried to be contracting or transmitting, because this goes both ways, transmitting the disease. So then we confronted the evidence around that, and we say and ask ourselves, what are the policies from the hospital for our staff? So what are we asking to do to prevent this issue in the hospital? So when we found what we need to do, so we ask ourselves, what's the difference between what we have to do and the parent needs to do? If we are screening at the entrance of the hospital, and we are coming and follow the guidelines to wash our hands, put our mask, as all we have been doing before the pandemic. Every time we go in the environment of the baby, we have watched before and after. What's the difference? And we go home with our family, and then we come back the next day. So what's the difference with that approach to our staff, to the parents? The parents are the same. One parent comes to the time, is screening properly at the entrance of the hospital, is screening again in our unit. There is special rule for our unit. They follow those guidelines, they stay with the baby, follow the rule, and they go home, and they can come back again as all the staff go away. So with this layout, we were able to find out a common ground that we say, as long as those parents can follow this guideline, they are in the same level of the staff. So there is no risk, less or more about that. So now moving forward, what we can do? So our goal need to be and has to be both parents at their leisure. We need to bring all the parents at the same time, mom and dad. They are a diet that has to be connected with that baby, because the overall health of that baby and all the research that have been done is an important component of the overall health and the development of the baby. So one baby, one mom or one dad at a time doesn't could offer us. Our goal is to bring both parents. How we can do that? Bring the administrator on board, showing the facts, showing the results, show them what we have been able to accomplish as a neonatal care before, because we are not changing besides the mask, the regular prevention of infection in the unit. The new thing for us is the screening at the entrance of the hospital and the mask. The rest have been with us since the existence of neonatal care. So we are very good to prevent dissemination of infection in our unit. So that's the goal. How are we going to reach it? That's what we have to discuss. That's what we have to talk about. That's what we have to bring all the people. That's what innovation, thinking out of the box, generosity, and leadership have to come to play.
Absolutely. So now, Dr. Monterrosa, I really want to touch base with you on the mental health of those families and the feelings and the emotions that we had just chatted before. And it's been 4 months now. What have you noticed on those parents? Because this is, I think, was a huge concern before the pandemic, on the mental health of parents who spend time in the NICU. And I feel there is a different layer right now of stress that was going to be carried on once they leave home. So what have you noticed on these last 4 months?
Well, you well know, you have been a mother of twins with premature baby. Your story is amazing. It's in a book right now. And you know, just to be told that you're gonna have an early labor and you're gonna be confronted with a premature baby in the unit, the level of anxiety for those parents is indescribable for me. And this is an abnormal time. We are not talking this time. So regular time, we are addressing those issues. We know how every aspect of a premature baby or a premature baby stay in the unit brings to the parents. So now you have compounding those issues with the external threat that we don't know too much about it. And you can imagine how escalated the situation is. So what we have been noticing in our unit, which is mostly what everybody's noticing in all the units that have been dealing with this situation. Starting with the parent, the anxiety level multiplied 5-10 times. The stress that those parents are putting on now at the beginning of this new policy, when suddenly they come to the unit and there is this stop to all what we have been fighting to teach them. You are important, you are part of the care, your presence is preponderant to be here. This is the help that we want to give you. And then suddenly, from the one day to another one, we say, you know what? A new game, a new sheriff on town, we need to stop this thing. So that is a big, big shocking thing for the parent. And you notice it right away in the crying time, the stress time, and the relationship between them to which one and how long are you gonna stay between dad and mom. And that breaks heart to everybody in our team. The long-term harm is something that has to be looked at. When those data start coming out, we're gonna start noticing what is expected. This parent not only has to cope now with the stress of the own baby being premature in the unit, but also because of the pandemic, they're gonna have child at home. They have to be teachers, they have to be educators, and everything starts summing up. And we don't know, or we can assume that it's gonna be devastating, but the real data is coming down the pipe. So that's why we need to start being more proactive, reinventing the wheel, and sometimes bring new ideas, bring new collaboration, learn from here, learn from our own mistake, and get the good successes in another place, and start building up little by little this trust, this partnership that we have building with the parent during this time of family-centered care that we're going to be talking later on, and put it on front right away. Because if we don't do it now, we are exposing a whole generation of parents, families, and premature babies to something that we already know is devastating.
Absolutely. And your hospital was one of the family integrated care hospitals. You adapted that model. I saw in real life how parents were engaged in your unit, always providing support and education for families during their hospital admission. My question to you now is, you know, for my personal experience as well, because I spent 5 months in the NICU, 10 to 12 hours a day with my son, learning about him, getting ready to bring him home, feeling empowered to bring a medically fragile child home. I learned how to advocate, and I know this is what you teach also your families. And now that time has kind of been cut because of the pandemic. How are you preparing those families to take their babies home now after spending months in the unit, after probably not sharing the knowledge and the skills they gain in the hospital with the other parent? How are you preparing those families to take on this responsibility at home and still try to cope with these mental health issues that might raise down the road?
So let's start with the program itself. So family-centered care was a great project led by Carol O'Brien from Mount Sinai Hospital in Toronto. We were looking off in the Maritime in New Brunswick to have one of the two units in the original pilot and the general project that involved not only Canada, but also New Zealand, Australia, and some European countries. And from the result of that project, which is family-centered care, and the goal is to bring those parents to the decision-making of the care of the baby during the unit. And the results were published in 2018 in Lancet and have been proven that the benefit of those policies are superb. So in that program, what it is train those parents, and we are very lucky to have in our St. John Neonatal Care Unit a superb neonatal team led by Kelly Watson and Kelly Northrop and Valerie Cowan. And we build a team that teach those parents, teach those nurses in our unit to be part of this project and work together. And the parents love it. And you know, our unit, we design even a room for them to receive the teaching, to collaborate by video conference with another parent of the project around the country, around the world. And the results are stunning. So baby breastfeeding rate go to the roof, the bonding go to the roof, growing is faster, the apnea, which is the pause the baby to breathe during the stay at the prematurity time, get less and less, implying less medication, less intervention, and the neurodevelopmental outcomes when they are growing up are superb too. So after those babies are preparing to be discharged, then we train those moms to how they're gonna be noticing that a milestone for growing up, immunization, and feeding goal. And we were bringing to the unit, following up with a whole team. Then the pandemic hit us. So now we're preparing in a way that we are first, and we talked about that later on, bring technology to keep the family together, but at the same time, giving those parents the reassurance that with that technology and with that availability, we can do e-consults, by example, e-follow-up, but we wanted to call it that way. And that way we can don't disrupt that bonding that we have building with those family for the benefit of the baby in a bad way. So those are little steps that we are building up to be able to cope in this time. Because this is for us to stay. This is not gonna go away. This is something that we are very lucky in Canada to have under control so far, but we don't know when those part economy coming back. So we have to be prepared, and we have to have everything in place that is come to human nature, regular nature, this program doesn't stop anymore, and we are prepared for what is coming in the future. So that's what we are working out right now. It's all try and error. It's not a one-size-fits-all. This is something that you have to, as I say, thinking out of the box, bring the best of your team, motivate your team, all the team bring together the idea. And our St. John Regional Neonatal team is superb. You know those things. But I have to be very, very proud to the team that we have here. They're second to none. And they just need the little spark, and they go all the way. And that's what we have in the result that we have so far.
Absolutely. And I've seen your team in action there. But you mentioned a little bit of technology. How do you see technology playing the role in your unit? Because you're already using telehealth to have follow-up appointments with families who live remotely, and they were not able to come to St. John from a neonatal follow-up appointments. How do you see that working for your unit at this time?
So you will say it. When we renovate our unit like 5 years ago, we were thinking, and we tell to our team, we have to think our unit in a way that the administrator don't want to give you more money for the next 10 or 15 years. So we have to think ahead of what's coming. And at that time, video conference was coming to the place. So we include a room with a video conference capability, that we have a camera and a big TV in the room, and that's connected to the safety net in the hospital, and they can interact for education purpose, for interchange purpose, parent to parent, physician to physician, team to team. So that was then, before the pandemic. Now the pandemic hit us, and then this new need for changes in policies come to place, and we cannot sometimes fight all the way around to our administrator in terms of what we need or we can do. So one idea is not new. The CPVF already know about that. So what we're thinking is how we connect or keep connection for those mom and dad and the rest of the family when one of them is only allowed to be with the baby. So we say, let's look for a video conferencing private in the room. So we designed a little pod with the iPad inside, when through the hospital network, and only for that purpose, we're gonna allow those parents to be in contact with the partner, his dad or the mom, and another sibling. And they can chat each other, share each other, talk to their sibling each other, share those ups and downs all the time in the unit. And I think that's the first step. And we are calling FaceTime for premature family. And it's coming to our unit in the next 2 or 3 weeks, depending on the provider. And that's with the support with a lot of partners in our unit. Secondly, we need to think it beyond that. So how are we gonna be bringing technology to not only talk, but at the same time be able to monitor. So it's a lot of labels, monitor pads that can be wireless right now. So we can hook those babies with those type of pads that can be wireless, transmitting all the parameters that we want, and follow with those babies at home. If they need to bring the baby back or intervene, some of them are gonna allow us to do that, but are we gonna be in touch with those parties? There is some scale that can be waiting those babies at the same time transmitting through an app to that device, and then we can monitor growth. And there is some way that with the camera we can do neurodevelopmental assessment that in a follow-up clinic is going to make a big difference to pick up very early at some point what intervention we need to do. And no mention of portable device that from the public health point of view, a nurse or a technician can go with a portable ultrasound or a portable echocardiogram. The baby doesn't need to be exposed, or the family doesn't need to be exposed again to the hospital environment, and the cardiology or the neonatology or whatever health expert is involved can make decisions without even the baby or the family to be able to put at risk. And that's where we're looking in the future. But you know, neonatology care is expensive, and we have to look also for idea to foundation like yours or to partner like you have been designing around Canada with the provider of the device and video conference to bring it on board. This is a partnership, and the only benefit has to be the families and the babies.
Absolutely, Luis. I just wanted to finish on a very good note, because it seems sometimes there's things that are gloomy, but with people like you looking for collaborations, for solutions, I think I see a bright future. I see that together we can really recreate family integrated care in this pandemic time, because as you said, you might not go away, you might stay, and things, the way you do things might be different forever. But how can we still keep parents here? Because technology can never substitute the power of mom and the other parent or the dad inside the unit. So I wanted to leave us with a good note, make us hopeful that things will be better for all of us.
Well, you are so generous. I don't know if this is a good note or not, but in this pandemic, my own daughter, gave up our third grandchild in March 29th. And she was told even her partner cannot go with her. So can you imagine that stress for me here, because my wife is there with them, and I haven't been able to inform her to meet my new grandchild. So I feel the pain. It's not a premature baby, but I feel the pain. And that's, I think that little thing helped me to be a better human being. I always tell the parents in the unit when I meet them, I am coming here first as a human being, second as a parent, and the last as a physician. And that's the only way that we can understand what this parent and this family are going through. So I thank you. You are very generous. You are very humble. You are the hero with the Canadian Premature Baby Foundation, providing us with the support. Thank you very much.
Oh, thank you, Luis. I really appreciate your time today, sharing with us your work, your expertise. I wish all the best in your unit, and I hope I can travel and visit your unit again in the near future. Thank you.
Looking forward to that. Absolutely. Thank you very much.
Thank you. And everyone watching us at home, thank you so much for joining us here today. I will be back on Monday with Brenda Agnew, who is also a mom of a surviving twin. And she's going to be talking about how to manage a child with complex care needs at home after baby gets discharged from the NICU. And today you talk about mental health and how can we support parents in the NICU. And I wanted to let you know that Canadian Premature Babies Foundation have launched a program called COVID Care. And we are providing 2 sessions with a therapist online for families who need. You can get more information on our website, which is canadianpremis.org. Thank you and stay well.